My name is Dimitris Dourakis. I'm a surgeon, and I'm the professor of surgery at the European University Cyprus. Basically, my professional life is split in two. Half of my time I spend it with my patients because I do laparoscopic surgery, which means that I treat patients with chronic problems that require to have a surgery with a minimal amount of trauma. I want them to be back on their feet as soon as possible. And the other half of my time is spent with my students who I train in order to become better doctors, as I'm responsible for the simulation program at the European University Cyprus. This is the number 3 in a series of webinars called So You Want to Be a Doctor. And today's topic that I'm going to share with you is how to master medical skills. You've already gone through the topics of how to apply in a medical school, how to ace your interview, and so on. So today we're going to go to the next step. You're accepted in a school, and you are asked to perform as a doctor. What are we going to do? In the next 30 minutes, we're going to discuss about 3 different topics. The first one is what makes a good doctor. If we want to say how we can improve in something, we need to know what is our aim, what we're aiming at. Then we're going to talk about clinical skills, and we're going to explain what are the skills and how to achieve them. And in the end, I'm going to give you 7 great tips that I've learned throughout my career and I share with my students in order to improve your clinical skills. When we finish, we'll have some time for discussion, and you can send your different comments or questions in the chat room, and I'll be answering them. So when they asked me to give you this webinar, I said, okay, let's try to find out what I'm going to talk about. And I said, medical skill. Well, it's not as clear as that. What is a medical skill? So I opened up the dictionary and I found out that a skill is the ability to use one's knowledge effectively and readily in order to perform. So it means that we have something that we know, and then we're going to apply it. It doesn't mean that I just know something, but I can put it to good use. But then skill means something else. It also means dexterity or coordination. When we do a physical task, it means that someone is skillful, they can use their hands. So it's something practical, it's something manual. Right, so it seems simple. Let's get these words, ability, knowledge, effectiveness, and combine them with medicine, and we'll know what we have to learn. But it's not as simple as that, because when it comes to the question, what makes a good doctor, the answer is not as simple. There are experts, there are researchers, there are medical educators that have worked many years in order to find out what makes a good doctor. And I'm sure not better than them in order to give you a simple answer. So what do we do in these cases? Well, we ask the audience's help. So I have prepared a little poll for you. I'm going to put it in front of you, and I want you to vote. I would like you to choose what do you think is the most important attribute of being a good doctor? Is it having good knowledge? Is it caring for your patients? Is it being good with hands? Do you have to use technology? Do you have to be hardworking and very dedicated? Do you have to work well with others? So we'll wait for a while to give you the opportunity to vote. Just, you know that this is anonymous, so you can vote whatever you want, and we won't criticize that. But I just want to see your take on that. What do you feel? Okay, I see that people are still voting. I'll give you a few more seconds. I won't give you yet the answer, but one of the options is getting, the large majority of votes, which is something that is expected, meaning this is something that comes to mind when you think about a good doctor. Okay, I think we pretty much have our results. I don't see any more fluctuations, so I'm going to end this poll so you'll be able to see the results. So here are the results. Most of you believe that it's caring for patients. Number 2 is distributed evenly between being hardworking and working well with others. And then we have number 3, which is having knowledge. Well, being good with hands and using technology is a very, very small minority, or 0. But in the end, we know that all these are attributes of a good doctor. A good doctor should have all of these things. And especially, he needs to be able to apply his knowledge. So he needs to be able to perform. And nowadays, it's impossible to practice medicine without using technology. Now let's advance, because let's see where we're getting at. When we're talking about medical skills, what makes a good doctor, it's a pretty theoretical subject. So it means that we expect a good doctor to be a scientist, to be good with numbers, to be good with communication skills, to be very attentive in detail, to be able to solve problems and work well with others and under pressure. But also he needs to be professional, convince his patients and his colleagues that he knows what he's doing, to be able to work in a hospital and work in a public or private system. So he needs to know how the system works. You see, it's getting too complicated. Honestly, I cannot give you a tip on how to become a good doctor. This required 6 years of medical training, then a specialization, and then a lifetime commitment. But I thought of it a bit better, and I said, okay, we have medical skills, but what about clinical skills? And what are clinical skills? Well, clinical skills are the essential elements of doctoring. It's the classical skills that we expect a doctor to have. So when you see someone with their white coat or their scrubs going around and treating patients, these are the skills that is required of them to treat these patients, to perform. It's much simpler to analyze the subject because many medical schools have indeed, and in fact, courses that are called clinical skills, where we train students to do things like physical examination, how to examine a patient, how to put a diagnosis, which means that how to find the name of the disease that the patient is having, clinical reasoning, combining elements of different data from X-rays, MRI scans, lab tests, physical examination, in order to make a judgment, communication skills, how to talk to your patients, how to communicate with your colleagues, end-of-life skills, because sadly some of our patients will perish. We will not be able to save their lives, but we still need to treat them and know how to deal with that. Technology, by using new modalities like ultrasound, and in most cases, basic surgical skills. What do we do when someone is injured? What do we do when we have someone that requires suturing? So now I want you to vote again. I want you to tell me, I'm going to bring up the second poll, how do you think that students and residents are young doctors? It means that these are people that have just finished med school and they are starting their career. How do you think they are trained to obtain these clinical skills? Do they study at home? Do they train in a lab? Do they watch and learn in a hospital with other doctors? Do they practice on patients? Do they go and learn these skills when they deal with patients? What do you think? So again, I'm seeing that there's a lot of interest here. I see that the votes change with the click you're doing. With each click you're doing, we have a clear number 1 category, a number 2 and a number 3, but things change, so I'll give it a few more seconds to see if you have something else. Right, so let's see the results. I'm going to close the poll so you can see the results. So here it is. Most of you say that it's obvious. If you want to learn these things, go in a hospital, watch others, do them under supervision. Some of you say, yeah, but this is not enough. You need to be able to practice. So you need to practice on patients. You need to be able to have some patients to train on them. And some of you say, yeah, but why not train in a lab? Meaning, can't we train in a lab? Isn't it more convenient and safe? And a very small majority, let's study at home. Let's try to improve the skills when we're at home. And again, all answers are correct. We can use all of these things to train our clinical skills. Let's find out how. Well, obviously, when you need to learn something, you need to have knowledge. You can obtain this knowledge from books, from interactive training sessions like this one, from webinars, from online videos. The most classic approach we have is lectures. You know that lectures is like a lesson. You have someone talking to you and explaining a concept. But is it different than reading a book? Yes, it is, because they can be interactive. Even from the beginning of the 19th century, medical educators, professors realized that you cannot explain a disease or a problem or describe a patient just with words. So they said, let's make it interactive. Let's get the patient inside the amphitheater and have her or him describe their case. It's interactive, it's interesting. And yes, it was, but think about this patient, this poor woman who's exposed to about 100 students, talking about her problem and finding herself subjected to a physical examination in front of these eyes. You realize that something like this would not be accepted today. Just as a side note, for those of you that have heard the word operating theater, it originates from this. In the beginning, operating rooms were in fact amphitheaters, where you would have the surgeon, the expert surgeon, perform the operation in front of an amphitheater of young surgeons or students that would watch in order to learn. Again, if this seems a little bit archaic or barbaric, think this is 100 years ago or less. It's one generation before. And of course, there are problems with sterilization, with exposure, with patient decency, and so on. And now these things have changed, not a lot, but the big change is that we have audiovisual equipment, we have technology. So inside the operating theaters, we can use video cameras, endoscopes. We have different types of machines that can help us do our work. And through fiber optic cables or the internet, we can project that to an amphitheater so others can learn from what we're doing. But you see that the concept is the same. Someone is performing, other people are watching, and there's a discussion. So in order to add to that, we have added lab study sessions, because people still need to apply their hands. They cannot watch and learn only. They need to be able to do things. So we can set up labs in a medical school where there are models and students can study their anatomy, physical examination, how to identify different landmarks for anatomical reasons, or how to perform a physical examination. And last but not least, we have exactly what you voted there, ward rounds and hospital practice. So in ward rounds, students or young doctors will go around a hospital with their attending physician. The attending physician will be a senior physician that is responsible for this unit, and they will go about doing everyday chores like examining patients, ordering different blood tests or radiographical exams, making decisions. And at first they watch, and after they participate in the decision making. In the end, by the end of their studies, they will be considered autonomous enough, independent enough to be able to perform on their own. So you see that this is a progression between studying, practicing in a controlled environment, training with patients, and applying your knowledge to patients. So here comes my first tip. If you want to do it right, study hard. This cannot be emphasized enough. If you don't know, if you don't have the knowledge, you cannot apply it. When you see something and you just want to repeat it without knowing why it's done, you become just a mimic, you become a parrot. So you need to study hard. And when you study hard, study some more. Why is that? For two reasons. First of all, just because you know something doesn't mean that you will be able to remember it, doesn't mean that you will be able to keep this knowledge. So you need to repeat your study. And the second most important thing is that medical knowledge changes fast. Things that 10 years ago we were considering them to be pretty much solid, nowadays they're considered to be outdated. So the fact that you learn something in med school doesn't mean that it's correct and it will be applied throughout your career. So we need to continue studying throughout our whole medical career. Please remember me, this is the most important tip I can give you. Now, modern medicine has evolved and it's fast-paced, it's technology-driven. We want exams, we have scans, we have blood tests, we have technology aiding us. It's high precision. There is no margin for error. We do not accept mistakes as might have been in the past. In the past, in the time of our grandparents, when a patient died, it was God's will. If the patient was saved, it was the doctor's hands and the doctor's brain. Nowadays, you cannot accept any type of mistakes. And we've learned a lot by using the analogy between car crashes and airplane crashes. So we take our car every day to go to work, for shopping, for fun. I fly several times per month for business reasons, and I'm sure that most of you take the plane frequently or less frequently. But irrespectively of how frequent you use something, the only time that you're going to think about not having an accident is when you enter a plane. You don't think when you enter your car that this might be the day where you have a very serious accident that may be fatal. Even though the chances of having a plane accident are more than 100 times less than a car accident, this is what we're afraid of. And it's for a very simple reason. Because plane accidents are catastrophic. We know that if something happens, it might be fatal. But there's another difference. The other difference is that we accept car crashes. Sadly, I've had friends that died in a car crash. I've never had a friend who died in a plane crash. We say that it's normal to have car crashes. If a car crash happens, we will mourn, we will say, okay, it's bad luck, and we will go on with our lives. If a plane crash happens, it will not be acceptable. We will say, what happened? This cannot be done. This cannot be accepted. We need to go through that, analyze our data, and change everything in order to avoid this. And the same principle applies to nowadays, to modern medicine. We do not accept errors. We go and analyze, find out what was wrong, and avoid the same mistake. So here are some challenges that happen, especially today in medicine. Emergency rooms. I'm sure you've seen these images in different medical shows that are popularized nowadays. I will never forget the first time I set my foot as a student inside a busy emergency room. I was supposed to be there in order to learn, but the only thing I felt was fear and disorientation. Everyone was walking around doing their job. I felt useless because I could not even ask questions. Everyone was running around, people were injured, they were asking for doctors, and I just wanted to disappear in a corner in order not to disturb anybody. I felt so out of place there. Then we have intensive care units. It's more calm. You don't have the crowded, it's not as a crowded place as an emergency room, but you have patients that are seriously ill. You might have a patient connected to 10 or 20 different machines, and even the slightest alteration, the slightest change that you might create in one of these machines might be detrimental or beneficial to their life. So this is very high precision. There is zero margin for error. And of course, there are more modern concepts like patients with COVID-19. They're there. We're isolated because of that, but we need to treat them. So how can we send students to treat or identify or examine patients with a disease that they might contract and they might spread to others? Can we seriously tell them, okay, there's your patient, go and examine them, or look what I'm doing and you'll do it? If they do a mistake, they'll contract the virus and transmit it to others. So here's my second tip. The second tip, by having all these situations in consideration, is to train. I cannot overemphasize how important it is to be prepared for what will be asked of you. You cannot enter a busy emergency room and not knowing what you're supposed to do. You'll be lost, as I was. So what can you do about that? Well, there are technical skills. Technical skills means that someone is expected to be able to perform something. If a doctor comes to you and tells you, can you measure this patient's blood pressure? This is a technical skill. So you should be able to have trained this skill at your university or even at home with a sphygmomanometer. Everyone nowadays has a sphygmomanometer, and say, yes, sir, I'm capable of doing that. What about suturing? What about doing a physical examination? All these are technical skills that should be trained beforehand. Then we have presentation and communication skills. We can sharpen these by doing presentations, by presenting cases, by acting as if we're communicating with colleagues or patients in role-playing situations. So try to prepare yourself and know how you're going to talk to your doctors, how you're going to talk to your attendings, to your fellow students and your patients. And last but not least, you can train in clinical scenarios. As you can see here, we can recreate environments that are pretty much similar to a hospital, where the students can train on how to approach a patient, how to examine them, how to make decisions before dealing and treating with a real patient. So if the burden seems to be very big, practice with your colleagues. It's easier to lift something when you're a team, or practice alone. In the end, this is what is expected of you, to be able to lift the weight of medicine on your own shoulders. Don't get disappointed. Practice makes perfect. And if at first you feel that you're not good at something, repeat, 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 study, train some more, and in the end, you'll be able to do it with your eyes closed. How can we make our lives easier? Here comes tip number 3. Use technology. Your generation has the advantage of being able to access and use technology that we never dreamed of. When I was a student or an intern, the only technology we could have was a notepad with our notes. And we had to go through paper files in order to identify patient problems and train and find out what's wrong. Now you can easily have virtual clinical cases, which are like computer games. So when you study something, you can go and play this game, read what the patient is all about, make your choices, and see what happens. There are virtual experiments that are available. When we want to see what happens when a patient is bleeding and when they will die, we don't need to kill them, we don't need to stab them. We can just run a simulation and see what happens when they start losing blood and what types of fluids we need to give them in order to replace the blood that they have lost. There are virtual teaching tools with augmented reality and virtual reality. For those of you that don't know what augmented reality is, it means projecting a virtual reality model in a real image. This can be done by observing the screen of a tablet or a cell phone. And what you see here is a patient that is having a liver tumor. So the piece of paper that they're having on their chest is called a marker because it helps the computer to identify if the patient is turned sideways or facing the screen. And you can see a model of their liver. The blue is the veins of the liver, the red are the arteries, with the tumors marked green. So we can have a real 3D image of this patient's condition in order to understand what he has or plan a surgery. And of course, there are what we call computer task trainers, expensive pieces of hardware where we can emulate different situations. Here is a task trainer we use to train our students in basic laparoscopic and surgical skills. But what happens when we don't have all this available? Do we really need all this technology? Not really. And here's my fourth tip. If you don't have access to all these things, think simple, create simple solutions. So you can create study models from simple materials. Don't feel trapped that you need to study only from your books. You don't have plastic models. Create a paper skeleton. Create models from Play-Doh, or use paper to recreate the three-dimensional anatomy of, let's say in this case, of the inguinal ligament. It will help you identify, learn, and process the information. You don't need expensive material. You can learn how to suture on a piece of sponge. You don't have augmented reality. Use body painting. Draw the kidneys on the back of your colleague in order to know where their position is and what their anatomical relations are. You want to train in surgery? Create your own pelvic trainer. You can use a tablet, create a construction like this with cardboard, and you can train all you want. So you see, there's always a simple and cheap solution when you have you want to train. And when you train, there's a very big advantage because you can learn from your mistakes. And this is the fifth tip. How do you do that? Well, you do that by using simulation. What does it mean? It means that instead of throwing you in a hospital, throwing you in front of a patient, we can recreate situations that are very similar to what is expected of you. So you can play the role of the patient, of the doctor, you can have actors acting like patients, you can have robotic patients, but in the end, you get to train and prepare for what will be expected of you when you go to the hospital. And basically, this allows students to make any mistake they want and to gain experience because this is controlled. No patient is harmed. No patient is going to be killed by any mistake that you're going to make. So here's an example. This is the expectation. This is a student that is simulating a situation where they have a fracture of their neck. They had a very bad car accident and their cervical spine is fractured. So their fellow student have to place a collar and tape the head to the bed because if they move it sideways, they might become paralyzed. And this is some problems, some blunders that happened, like putting the tape over the patient's eyes, and this is a very adhesive tape. Imagine that when you have to remove it, it will be very painful. Or putting the collar, instead of placing it on the neck, placing it on the patient's head like a rugby helmet. In the second situation, you realize that this patient would be paralyzed. They would be quadriplegic or tetraplegic or paraplegic. So no one said it's easy. What can we do to make our lives even more easier? And the answer is be a team player, work with others. Medicine is highly competitive and you'll be asked to compete against your fellow students, but most importantly, now is an area of globalization. When you apply for a position, when you want to work somewhere, you'll compete with students throughout the world. So it's not your friend who's your enemy or your competitor. Try to have some friendly competition in order to find the motivation to improve. You set your benchmark, you set your aim, and you try to achieve it. And the first one that achieves it goes to a higher level, and the others try to compete with them. You can change roles. So by using a team approach, you can alternate playing the role of a patient, of the doctor, of the assistant, of the student. And as such, you can find out how it feels to be in different situations. And never forget that by working together, You can overcome obstacles that are very difficult. It's much easier and more effective to work as a team than working individually. When I think about it, studying medicine is like trying to run an Ironman competition, a triathlon. It's hard, it requires concentration, devotion, and very good preparation. And Hippocrates, a few thousand years ago, said that the art is long, but life is short. It means that medicine, the learning medicine, is so long that one lifetime is not enough. And it's true. And in some cases, it's very difficult because you need to study hard, you need to practice, you'll pass lots of exams that will validate that you have the basic knowledge, and then you'll advance and repeat the same process again and again and again. And I have to say that it never finishes. Even if you become a doctor, even if you specialize in something, you still need to be up to date and you'll continue with the same process. So before giving you my last tip, I have one last question for you, which is, so you really want to be a doctor? What do you think? Okay, we'll give it a few more seconds. Right, I think it's obvious. I'm going just to end the poll because we already have an answer. And here are the results. So we have a group of highly motivated people that are sure they want to be doctors. Some of you, and I'm glad that they still want to think about it, when you choose something like medicine, it should be done only if you're sure. It would be really a bad idea to start and then regret it and try to do something else. It's not catastrophic. There's always many ways to change afterwards, but it's better to start by knowing what you have to do. And there are some people that say, okay, it's not for me, which is fair enough. It doesn't mean that medicine is for everybody, and everyone is good for something. It's good for their call. They have a calling in life. So with this, I want to give you my last tip, which is keep your spirit up. Studying medicine and practicing medicine is a very hard trip. It's very rewarding. It's extremely rewarding in every sense you can think of. You need to be optimistic. You need to keep your smile. You need to let some steam off from time to time. Just try not to lose your head in the process. So thank you for watching this speech and this webinar. And now I think that we